Absolutely. And I mean, there's so many athletes that, they just reach that plateau in their program. They can't get that to that next step. And it might just be the iron.
Absolutely. And I think that if we start looking, as doctors, I actually think that that's one of the reasons why the funders get anxious when we do talks like this, because when we start looking, you've got to take action. There's no point in testing somebody's iron or their ferritin and finding it to be low and then giving them oral iron, let's say for argument's sake, and not testing it again. So that's my second sort of soapbox moment, is to say, yes, you must know your numbers. But the second is as important, is that what if I took my oral iron or even parenteral iron for that matter, did I check again to make sure it worked? Because one thing that is true is that bad things happen to good athletes as well. And we can't just assume that all iron deficiency in athletes is because of inflammation. We can't just assume that it's, little GI bleeds or, maybe poor diet, and all these things are true. This is the reason why most athletes become iron deficient, is because of the physiology around their exercise. But a good athlete can also get a colon cancer. A good athlete can also get any luminal malignancy that can cause bleeding. And I think that is sort of the sobering moment. We can all give as much iron as we like, but we are not only looking after an athlete, we're looking after a patient. And if that patient does not show an adequate response, despite compliance and despite all the things that we tell them to, take it with an orange juice, take it straight after training, and that iron or ferritin doesn't pick up, you are obliged to look a little bit deeper.
I agree 100% there, Claire, and that's so important that you stated that. We can't just put a little plaster on the wound. We need to go ask the question why, and that's such an important point.